Hi everyone, and thank you for listening to this lecture that will cover lessons 7 and 8. In lesson 7, we're going to be talking about medical terminology related to the cardiovascular and lymphatic systems. And in lesson 8, we'll be talking about medical terms related to the digestive system. So let's get started. So some objectives for this lesson include building, translating, pronouncing, and spelling medical terms built from word parts, as well as those not built from word parts. We're also going to learn about some abbreviations associated with the cardiovascular and lymphatic systems, as well as learn to identify medical terms by their clinical category. All right, so here you're looking at the cardiovascular system. And this is a very basic kind of pared down image. So let's talk about what are the different parts of the cardiovascular system. So the first structures that I want to talk about are the arteries. And I always remember that arteries are moving blood away from the heart. Artery starts with A, so A, away for arteries. Blood vessels that carry blood away from the heart. Now, their counterparts are the veins, and the veins are the blood vessels that are responsible for carrying blood back to the heart. All right, so the heart is kind of the main organ that is driving this system of the cardiovascular system. The heart is pumping, and when it does that, it pushes blood through the system. Now, we'll learn as we dive into anatomy a little bit deeper that the veins, the blood that is in the veins is not pumped back to the heart, but it is actually squeezed back to the heart through skeletal muscle contraction. So that's why it's important for us to get up and move around and do some regular exercise. So arteries and veins are referred to as blood vessels. They're tube-like structures that carry the blood through the body, and that also includes the capillaries. Now, the capillaries are very, very, very small blood vessels. They're so small that most of them can't be seen with the human eye, so we call those microscopic. And the walls of the capillaries are so thin, they're one cell layer thick, that it is very easy for gases and nutrients and water to move in and out of those capillaries and allow materials to pass between the blood and the tissues through those capillary walls. Again, the heart is a muscular cone-shaped organ. It's about the size of our fist, and it's located behind and protected by the sternum. All right, it lives in the thoracic cavity. All right, and its job is to pump and circulate blood throughout the body. All right, so here's a picture of that kind of looping system. Now, the cardiovascular system is different from the lymphatic system in that the cardiovascular system is like a cycle. If we start at the heart and we have the arteries leaving the heart, we go into the capillary beds, and then blood is returned back to the heart. It has like a circular flow, right? But the lymphatic system doesn't. It's only a one-way street. Something else to note here is that the adult body contains approximately 5 liters of blood. If you were to think about one of those big, like 2-liter jugs of soda, we have about 2.5 worth of those bottles. All right, so here we're looking at the heart, and you can see that the heart has 4 main chambers, and the 2 top chambers are called atria, atrium for one, and the two bottom chambers are called ventricles. Now you'll notice that the wall of the heart along these bottom chambers, let me get a pin here. These walls, all right, especially the one of the left ventricle, is super thick muscular layer here. And the reason why is because the left ventricle of the heart is responsible for pumping blood out to the entire body, whereas the right ventricle is responsible for pumping it to the lungs. So let's take a little tour through the heart here. So the heart, blood is going to enter the heart through the superior, which I just drew an arrow, and then down here, inferior vena cava. And it is going to enter this right atrium right here, if you see this space. So blood is going to go into the right atrium, and then it's going to flow down through this valve called the tricuspid valve. I always remember that. Tri-right. Always try to be right. That way you can remember that the tricuspid valve is on the right side. So blood flows from the right atrium through the tricuspid valve into the right ventricle. Now from there, it is going to get squeezed up through the pulmonary artery. Remember, away. And a lot of times there's a misnomer where we say, oh, well, all arteries carry oxygenated blood. No, that's not true. All arteries are clearly defined as those vessels that carry blood away from the heart. So the pulmonary artery carries unoxygenated blood to the lungs to pick up oxygen and simultaneously drop off carbon dioxide. All right, so there's a valve here that it goes through. That's called the pulmonary semilunar valve. So blood gets squeezed up into the pulmonary artery. It goes to the lungs, out through these pulmonary arteries, and then it is going to come back from the lungs via the pulmonary veins. They're right here. Pulmonary veins. So the pulmonary veins are carrying oxygenated blood, and that oxygenated blood is going to pour in to the left atrium. The left atrium. And once blood is in the left atrium, it's going to flow down through another valve, which is called the mitral valve or the bicuspid valve, or it also goes by another name, if it's not confusing enough, the left atrioventricular valve. And then the right atrioventricular valve is on the other side. All right, so blood comes back from the lungs through the pulmonary veins. It goes into the left atrium, down through the bicuspid or mitral valve, and now it's in the left ventricle. All right, this is the left ventricle right here. And now this very vast muscular wall is going to give a big, strong squeeze, and the blood is going to go up through the aorta. This big red vessel here is the biggest vessel in our biggest artery in our entire body. Vena cava is the biggest vein in our bodies. So when the blood gets squeezed from the left ventricle, it's going to go up through the aortic semilunar valve. Now, when the semilunar valves are open, the atrioventricular valves are closed, and vice versa, so that the heart can move the blood in one direction and we don't get weird backflow, which wouldn't be good. So blood goes up into the aorta, and then it goes on its journey throughout the rest of the body to the various tissues. It goes up to the head, it goes down the arm, all over the body. And so that is the flow of blood through the heart. All right, so let's talk about some functions of the cardiovascular system. So the first one is that it pumps blood. We already said that. The heart is this amazing pump that moves blood through the heart to the lungs and to the rest of the body. And that's the way that our body is able to filter the blood and get nutrients and pick up oxygen and drop off carbon dioxide. Almost everything that the body needs and does is reliant on the functioning of the cardiovascular system. And as we begin to talk more about the anatomy and physiology of each of these systems, you will see how they are intricately connected. And if one of them isn't able to function properly, then that is going to impact other body systems. So the cardiovascular system pumps blood. What else does it do? Well, it transports oxygen, nutrients, immune substances, hormones, and a bunch of other chemicals to and from the organs and the tissues, right? We already said that. And then lastly, it creates carries waste products, away from the tissues, right? So that they can be either filtered out through the kidneys or the liver as urine or feces, or as waste gases through the alveoli in the lungs. All right, let's talk a little bit about the anatomy and the functions of the lymphatic system. So here, all these green little dots and lines, this represents the lymphatic system. So let's talk about some of those structures. Well, the first thing that I want to talk about is lymph. And lymph is the actual fluid that is carried by these lymphatic vessels. And these vessels run parallel with our arteries and our veins. And they are also intertwined within the capillary bed. So, form follows function. And this makes it very easy for the lymphatic vessels and capillaries to be able to pick up those extra fluids from the tissues and whisk them away back to the venous system, and so that they become the majority of the lymph becomes part of the cardiovascular system again at some point. So the lymph is a transparent, colorless fluid. It contains blood cells, and like I said, it flows in a one-way direction to the heart. All of the lymphatic fluid will be drained eventually into the vena cava and become part of the blood again. Now, these little dots that you see are called lymph nodes. And these little bean-shaped guys are these magnificent filters that our lymphatic system has, and they're composed of something called lymphoid tissue, and there may be just one along the path, or there may be a cluster of them. We do find clusters of them in the axilla, which is near the tail of the breast in the armpit, and also in the groin and in our neck, and also in the omentum that is feeds and nourishes our intestinal tract as well. Now, these little lymph nodes, like I said, are these awesome filters, and their job is to keep bacteria and other foreign agents like cancer cells from entering the blood. Now, it doesn't always happen that way, right? They don't always catch everything, and that is how metastasis occurs. Besides, cancer cells are very sneaky, tricky little boogers. The lymphatic vessels, like I said, are these green lines, and their job is to transport the lymph from the body tissue to the chest and other similar veins, okay? Now, some organs that help support and assist the lymphatic system include the spleen, which is a lymphatic organ that's located right below our ribs on the left side. It serves as a blood filter and also a blood reservoir. It's kind of like a big sponge. And we can live without our spleen. Now, the thymus is located in the mediastinum, and it's a lymphatic organ, and It's located right behind the sternum between the lungs, and this plays an important role in the development of the immune system because it makes something called T cells. All right. And I think I mentioned before, as we age, the thymus starts to atrophy. And by the time we're 75 or 80 years old, it's mostly just this lump of fibrous tissue that's really non-functioning anymore. And that makes sense if we think about how our immune system declines as we age, because that thymus is a big part of the health of our immune system. All right, so let's talk about some functions of the lymphatic system. First one is the lymphatic system is responsible for returning excess fluid from tissues in the blood. So, like I said, there's these capillary beds in the tissues where the arteries and the veins meet. They're these little, very microscopic connecting capillaries, little vessels, right? And interwoven between those capillaries are these little lymphatic vessels that insert themselves in those capillary beds. And because of the pushing force of the heart on the arterial side of the capillary, that forces fluids out of the vessels and into the tissues. And the lymphatic system is there to pick up that fluid if all is functioning correctly. So what else does it do? Well, it helps to maintain blood volume and pressure. If the body says, hey, you're taking on too much water, right? Pressure is too high, it's going to try to regulate itself, right? Or the reverse could be true. So it helps maintain blood volume and blood pressure. It also filters the lymph by trapping and destroying harmful cells, right? Like those cancer cells or invading microorganisms that could potentially make us sick. And then lastly, it generates disease-fighting cells, all right, that are part of our immune system. And a lot of times these immune cells will kind of hang out. They'll migrate from the thymus, let's say, and they will hang out in these lymph nodes until the time of crisis, and then they go to work for us, which is super awesome. So we can't talk about the cardiovascular system without talking about the composition of blood. So there are a variety of different blood cells that are found in blood. There are the erythrocytes, which are the red blood cells. There are also the leukocytes, which are the white blood cells. And there are other cells called thrombocytes. And another term for these are platelets. And these platelets are essential in helping us with blood clotting. Okay, and there's a variety of clotting factors that are in our blood as well as other different constituents that are just liquid and floating in there. So the solid part, or the formed elements, we call them, are about 45% of the blood. And then the rest of the blood, we refer to that as the plasma. It's the liquid part, and so that's the remaining 55%. And it's about 90% water and 10% other stuff, like clotting factors and salt that's dissolved in the water and various other things that are being carried in a liquid form around our bodies into our tissues and things. All right, so now we have a better understanding of the different parts of the cardiovascular and lymphatic system, as well as what their functions are. So let's look at some different word parts. All right, so some combining forms that I want to go over with you. First one is adeno. Adeno means gland. And it means node when it's combined with lympho, Okay. Now, angio is the combining form for blood vessel. And arterio specifically refers to as artery, whereas angio refers to any vessel, arterio specifically refers to artery. And then cardio is the term that refers to heart. Lastly, on this slide, the term echo is the term that we use to represent the word sound. Other combining forms include electro, which means electrical activity, like electroencephalogram. Lympho, which means lymph, or that clear fluid that is being carried by the lymphatic vessels. Phlebo or veno are both used to refer to vein specifically. And spleno is the combining form for spleen. And lastly, on this slide, thrombo is the word part that we use to mean a blood clot. So let's look at some suffixes. The first one is AC, which we've seen before. It means pertaining to, right? Cardiac, pertaining to the heart. Graph is the term that we've seen before, is an instrument used to record. Electrocardiograph. Megaly is the enlargement of something. So if there was an enlargement of the spleen, we would say splenomegaly. What about penia? Penia is the suffix that refers to an abnormal reduction in something. So if we have leukocytopenia, that means we have an abnormal reduction in white blood cells. And lastly, on this slide for suffixes, sclerosis. And sclerosis means the hardening of something. Now let's look at some prefixes. First one I want to look at is Brady. And Brady means slow. So if we have an individual that has an abnormally slow heart rate, we would say that they're bradycardic. And the flip side of the coin, if we have a patient that's heart rate is too fast, we would say that they're in tachycardia. Now, some medical terms that are built from word parts. The first one that we have on our list is arterial. And arterial means pertaining to, AL meaning pertaining to, and arterio means artery. So pertaining to the artery. What about this one? Arteriosclerosis. Remember, osis is the condition of. So this would be the condition of hardening, sclerosis of the arteries, arterio. Remember, I gave the example of bradycardia. Bradycardia is when we have a slow heart rate. And cardiac is the term that we use to say pertaining to the heart. The cardiologist is a physician who studies and treats diseases of the heart, and cardiology is that study of the diseases of the heart. And then lastly on this slide, cardiomegaly. Do you remember what megaly means? If you said hardening, or if you said enlargement of, you would be correct. So this would be enlargement of the heart. So let's talk a little bit more about thrombosis. So we said thrombo refers to clot. So this would be the condition of having a blood clot or some sort of blockage in an artery. So you can see the vessel on the left, the artery is a healthy artery. It has this nice open lumen, which is that opening of the vessel. We refer to that as the lumen. And it looks really nice. A clear pathway for blood to flow through, nothing impeding the flow of blood at all. But if you look at the image on the right, you can see that there is some plaque that is attached to the wall, and then there's also a clot that has formed there, a thrombosis, right? And thrombosis is not a traveling clot. If we have a part of that clot, like we see here as a thrombosis, that breaks away and goes traveling through the cardiovascular system, we call that an embolism. Okay, or an embolus. So here, the plaque that adheres to the wall is very sticky and rough. And so the blood cells will start to stick to that plaque, and then other blood cells will start to stick to those until we have this abnormal condition of a blood clot that is now impeding the flow of blood or completely blocking it altogether. And then we get no blood flow downstream, and we refer to that as ischemia. So let's look at some other medical terms. The next one is cardiomyopathy. Cardiomyopathy. And that is a disease of the heart muscle. Remember, pathy means disease, cardio means heart, and myo means muscle. Now, a hematologist is an individual that specializes in the study of blood and the diseases of blood. And hematology is that study of blood. A hematoma, or sometimes we call them hematomators. But this is basically a blood clot that is in the tissue or the skin. So if you ever had a bruise, then you had a hematoma. Hemostasis. Hemostasis is a huge buzzword in surgery because that's one of the major goals of surgery is to prevent bleeding or to stop bleeding. And the stopping of bleeding, the term that we use, is hemostasis. Now, what about the word intravenous? Intravenous meaning within the vein, right? Within the vein. And this is, we usually abbreviate this as IV. So if you've ever had an IV or you've heard of someone that's had an IV, they put a little there's a needle that's loaded inside a little catheter, and they use that to enter the vein, and the needle gets removed and the little catheter stays in there. And then this allows us to be able to more easily instill medications into that IV so that it can go into your cardiovascular system and be distributed to wherever it needs to go. And here is an image of a hematoma or a hematomator. And this is post-operative. And if bleeding continues to occur in the underlying tissues, then a clot can form in those spaces and you get that hematoma. And then here's an image of intravenous catheter, right? An IV. So you can see that there's, can't really see, but where that blue little guy is, there's a catheter that's going through the skin and into the vein, and then a tubing can be hooked to this so that we can easily give the patient medications. All right, some other terms that are built from word parts. The first one is leukocytopenia. And leukocytopenia is an example that I gave a few slides ago, and it means the abnormal reduction of white blood cells. Remember, leukocytes are white blood cells, and pinia means an abnormal reduction of. Now, what about lymphadenitis? Lymphadenitis, you remember what itis means? Itis means the inflammation of something, right? So here we have inflammation of the lymph nodes. Those little guys that do the filtering, right? That could be a sign that there's some sort of infection going on, or an increased immune response in the body. If you've ever had an upper respiratory infection or something like that, and you go to your physician and they're kind of feeling around your neck, like underneath your jaw, and they're like, oh yeah, they're, down by kind of your collarbones, they're feeling around, they may be feeling for that immune response that would indicate infection, because those lymph nodes and those glands can get swollen. All right, lymphadenopathy. So lymphadenopathy is a disease of the lymph nodes. Remember, lymph means lymph, adeno means gland or node if it's used with lymph, and then pathy is disease. Now, lymphoma refers to a type of cancer of the lymphatic tissue, or a tumor of the lymphatic tissue. A couple more here. Myocardial. Do you remember what myo means? That means muscle, and cardio means heart. So this is pertaining to the muscle of the heart. And phlebitis, again, phlebo or veno means vein, and itis means inflammation of. So phlebitis is inflammation of the vein. And lastly, here on this slide, splenomegaly, which is enlargement of the spleen. All right, a couple more terms. The next one is tachycardia. Tachycardia. Remember, cardia pertaining to the heart, and tachy, all right? It's beating too fast. Tachypnea. Remember, P-N-E-A, that refers to breathing, all right? So what do we have going on here? The patient is breathing too fast, or faster than normal, right? A thrombocyte, again, a thrombocyte is also called a platelet, okay? And it is a blood clotting cell, right? It helps us to stop bleeding. Thrombocytopenia. Remember, penia means a reduction of, or the abnormal reduction of. So here we have an abnormal reduction of thrombocytes, or an abnormal reduction of platelets, right? We also call thrombocytes platelets. Thrombogenic. Thrombogenic means pertaining to the development of more thrombocytes. And then thrombophlebitis or thrombogenic can be the development of a blood clot, or propensity to develop a blood clot. And then thrombophlebitis would be inflammation of the vein, right, with a clot. And then thrombosis, the condition of having a clot. All right, so let's talk about some diagnostic terms built from word parts. First one is angiography. And angiography is a radiographic imaging of the blood vessels. Sometimes we will do these intraoperatively so that we can take a look at the vasculature. Now, an arteriogram is also a radiographic image, but that is of an artery, So angiogram, kind of just a general term for any of the vasculature, whereas arteriogram is specific to the artery and venogram is specific to the vein. Now, when we're doing vascular procedures, the surgeon will want some contrast dye, and that contrast dye will get injected into the vessel, and that will allow them to take an image and see the vessel, because that dye, even though it's clear, it doesn't look like it would dye anything, it has a special property, and that property is that it is radiopaque. And what that means is that it will show up on an x-ray, so that way the surgeon can view the vessel once they inject the contrast dye. Now, let's talk about an electrocardiogram. An electrocardiogram is the recording of the electrical activity of the heart, and it's abbreviated in one of two ways, ECG and EKG. All right. The electrocardiograph is the actual instrument that we use to record that electrical activity. And the electrocardiography is the process of doing it. Okay, so the gram is the record, the graph is the instrument, and the graphy is the actual process. That's the action word. Okay. And then lastly on this slide we have venogram. One term that I didn't mention here is the echocardiogram, and sometimes we shorten that just to be echo, E-C-H-O, and that is a recording of the heart using sound. So here's an image of what an arteriogram / venogram would look like. On the right, on the left side, you can see the right main branch of the pulmonary artery. Remember, we said the pulmonary artery leaves the heart and carries unoxygenated blood to the lungs to get oxygenated, and then it's returned by the pulmonary vein to the left atrium of the heart. Now on the right side you can see a vein, and this kind of tells us that it starts way up high at the common iliac. So remember our anatomy. The aorta comes off the top of the heart, it makes a turn, it goes all the way down the body, through the thoracic cavity, through the abdominal cavity, and once it gets low in the pelvic cavity, it bifurcates. Remember, a bifurcation is an upside down Y, and that bifurcation is the left and right common iliac arteries. Now, the vena cava does the same thing, but the vena cava carries blood back to the heart. So the bifurcation of the vena cava are called the iliac veins. All right, and here is what we're looking at: the common iliac vein and the external iliac vein, and as it kind of traverses down the leg, it gets some different names, although it is the same tube that is running down the leg. Is along the femur, which is that big thigh bone, it's called the femoral vein, and behind the knee, which is called the popliteal space, it's called the popliteal vein, and then it goes down the tibia, it's called the tibial vein. All right. But you can see how these look white on the x-ray, and that's because of the contrast dye. It gets injected, and then it allows us to be able to see these vessels. And then here is an image of an electrocardiogram. Remember, that's the recording of the heart using sound. All right, so let's look at a few terms built from surgical word parts. The first one is angioplasty. Remember, plasty is the surgical repair of something. So here we're surgically repairing a blood vessel. If we have to make an incision into a vessel, we call that an angiotomy. If it is into artery, we would call it an arteriotomy. If it's into a vein, we would call it a veinotomy. What about phlebotomy? Phlebotomy is creating that incision into a vein, and that's where we get the term phlebotomist. Now, what about endarterectomy? Endarterectomy means, remember, ectomy means that we're removing something, okay? We're taking something out. So this means the excision within the artery. And usually we are opening up an artery to take out some plaque. And this commonly happens in the carotid artery that runs up to the brain. And it carries oxygen up the brain. And if you were to kind of feel along the side of your neck, you would feel a pulsing. That's the carotid pulse. And sometimes plaque starts to accumulate on the sides of the carotid artery, and it starts to impede blood flow. So we will do a carotid endarterectomy. We'll also do those in class as mock procedures, which will be super fun. And so we incise the artery, we do an arteriotomy, and then we do an endarterectomy, and then we do an angioplasty. All right, the last term here is splenectomy. So what are we doing to the spleen? We're taking it out, right? Ectomy means the excision of, and so here splenectomy means we are removing the spleen. Okay, so what about some medical terms that are not built from word parts? Let's look at some of those now. The first one is anemia. And anemia is a condition where there's a reduction in the number of red blood cells, or erythrocytes. So this can be caused by a variety of things. Intraoperatively, it could be caused by hemorrhage, right? A lot of bleeding. It can also be caused by disorders that result in a decreased production of red blood cells or erythrocytes, or by an increased destruction of those red blood cells. So either way, there is a reduction in the number of red blood cells, and that is the definition of anemia. Now let's talk about an aneurysm. An aneurysm is a condition that happens in the side of a vessel wall. Okay, specifically the arteries. So if there's a weakening in the arterial wall, it starts to bulge out along the side, all right? And that's called an aneurysm. And the risk here is that over time, that aneurysm can rupture. And if it is an aneurysm of the aorta, which sometimes we refer to as a AAA, which is an abdominal aortic aneurysm, and that aneurysm ruptures, it's like a hose turned on, full blast, and that's a lot of bleeding, and we have to stop that bleeding very quickly or the patient will die. Blood pressure. Blood pressure is the pressure exerted against the vessel wall by the squeezing of the heart, the pumping of the heart, right? So there's two measurements with blood pressure, which is the systolic pressure and the diastolic pressure. So systolic is the top number, right, which is the contraction of the heart, and then diastolic is the relaxation of the heart. That gives us the two numbers, like 120/80, they say, is a good blood pressure for us. Cardiac catheterization typically occurs in the cardiac cath lab. It's a specialties area of the hospital in radiology. And in the cardiac cath lab, they can do various diagnostic procedures, and one of them is a cardiac catheterization. And this procedure is done by passing a small little wire or catheter into the heart, and they usually use a blood vessel in the groin, like the femoral artery. It's a nice big one that they can gain access into, and then they will thread that catheter up into the heart through those pathways. All right, and then they can take a look at the condition of the heart and surrounding blood vessels, and if they need to put in stents or something like that, they can do that as well. Now, cardiopulmonary resuscitation, you may have heard of it as CPR. We also sometimes call it BLS, which stands for basic life support. So CPR, cardiopulmonary resuscitation, is used in an emergency when we have an individual that is in cardiac arrest. So that means their heart has stopped beating, and by pressing on their chest, we can compress the heart between the sternum and the spinal column, and we can continue to pump that blood around to their tissues. Now, a complete blood count, also called a CBC, is a laboratory test, and it's a fairly common one, and it looks at all the formed elements in the blood, like the leukocytes, the erythrocytes, and the thrombocytes or platelets. Coronary artery bypass graft is often abbreviated as CABG, and we say that is cabbage. So if you've ever heard somebody had a cabbage, that's what they're talking about, a coronary artery bypass graft. And this is a surgical procedure, and what it does is it restores basically blood flow to the heart muscle, because the coronary arteries are the arteries that supply blood and oxygen to the heart muscle. And if those become blocked or the flow of blood is impeded, the heart's not getting oxygen like it should, and that can cause angina, which is a pain that is associated with blockages of those arteries. So they can harvest another vessel, like a vein from the leg or a vein from the arm, and they can use it as a bypass to hook in above and below that blockage and restore blood flow. Coronary artery disease, often abbreviated as CAD, is a condition that reduces the flow of blood through the coronary arteries to the heart muscle. All right, so this would be the disease that may lead to the cabbage procedure. A couple more here. Embolus. Embolus is that traveling clot or traveling material. Doesn't necessarily have to be a blood clot. It could be some plaque that breaks off and goes floating around. And you know, the biggest vessels of the heart are the veins and the arteries, but then we know they branch into smaller tubes, and then they branch again into even smaller tubes, and eventually that traveling clot or foreign material is going to get caught and trapped in a vessel, and it's going to block the flow distal past that blockage, and then we can get into trouble. And then lastly, here on this slide, heart failure, which is a condition where there is an inability of the heart to pump enough blood through the body. And because of this, the tissues don't get the nutrients and the oxygen that they need. And sometimes we also refer to this as congestive heart failure, or CHF. Okay, so here on this slide, we're looking at that abdominal aortic aneurysm that I spoke of before. A lot of times we call this a AAA. And you can see in the middle of the abdomen there, below the kidneys, right before the bifurcation, which is a common place for a AAA to occur, is that aneurysm. And you can clearly see that there's a bulging on either side because of a weakening of the wall of the artery, and there is a ton of pressure that is exerted on the walls of the aorta. Here we're looking at an image of cardiac catheterization. So you can see down here, let me circle it for you, right here. All right, so this is usually done in radiology, and they will insert this long catheter, usually a wire first, and then they will get the wire up into the heart where they want it, and then they'll put the catheter over the top of it, and they will guide it up into the heart, and they can inject dye and take images and those kinds of things to gain a better understanding of what is going on with the heart. Here we're looking at something called an automated hematology analyzer, and this is when they take that blood that is requested for a complete blood count, a CBC, and then they put it into this special machine, this analyzer, and it is going to process that blood and tell us how many millions of each cells there are. Here we're looking at the heart, and you can see those red kind of lightning like lines coming down the heart muscle, and those are the coronary arteries. And again, when there is a blockage in the coronary artery, or there's coronary artery disease, then this can impede the flow of blood to the heart, and that can cause heart attack. All right, so they will harvest a graft and they will make a little bypass, like we have bypasses on the freeway, right, where you can take like the truck route, or you can take a more direct route. And so this is a way for us to reroute the blood flow past or around that blockage so that we can restore flow to the heart. All right, so here we are looking at a thrombus or embolus in the brain. All right, so again, a thrombus is a stationary clot. An embolus is a clot or a piece of foreign material that breaks away and gets washed downstream and eventually gets trapped because the vessels continue to branch and branch and branch into smaller vessels. And so a lot of times they'll get trapped in one of those bifurcations, and then that impedes the blood flow to those tissues that are downstream. Some additional terms not built from word parts. Let's look at those now. The first one is hemorrhage, and hemorrhage is a rapid loss of blood, as in lots of bleeding. So if we have a patient come in with a ruptured AAA, or they have a ruptured spleen, remember we said the spleen stores extra blood. So if there is a lacerated spleen or ruptured spleen, maybe from a motor vehicle accident, that patient is going to be hemorrhaging or bleeding out, sometimes we call it. What about hypertension? Hypertension is a blood pressure that is above normal. And then we have hypotension, which is a blood pressure that is below normal. So hypertension above normal, hypotension below normal. Leukemia is a word term that refers to a cancerous or malignant disease of the white blood cells, and white blood cells are typically born in the bone marrow. All right, and so these are leukemia is characterized by an excessive number in abnormal leukocytes that are in the bone marrow. Myocardial infarction. This is a very complicated word for heart attack. Again, a myocardial infarction, or an MI, is death of a portion of the heart muscle that's caused by lack of oxygen. So there's something interrupting that blood flow. A pulse. A pulse is where the contraction of the heart can be felt, and there's several pulses throughout the body. There's the carotid pulse, which is right under the jaw on the side of the neck. We can also feel at the side of our wrist, right, and get a radial pulse, or on top of our foot to get a pedal pulse. Okay, so there's various areas where we can feel that pressure being exerted against the wall of the artery. Here's one of my favorite words, sphygmomanometer, which is a very long, complicated word for a blood pressure cuff. All right, so the sphygmomanometer is a device that is used for measuring blood pressure. And a stethoscope is an instrument that's used to listen to internal body sounds. So if you've ever been to the doctor and they have you, they put the stethoscope on your back and they ask you to take some slow, deep breaths in and out. That's because they're listening to your lung sounds, or maybe they might put it on your belly and they might be listening for belly sounds. They can also listen to your heart as well. And then varicose veins. Varicose veins are what we refer to as tortuous veins. And these are typically found in the lower extremities, but we have to have a little understanding of the anatomy of a vein to really understand varicose veins, because veins are different from arteries in that they have valves. And the reason that they have valves is because of the way that they function, moving blood back to the heart. So remember I said that for blood to get back to the heart, we have to contract our skeletal muscles. And that squeezing action of the skeletal muscles is what moves our blood along the venous system and back up to our heart. So as we squeeze our muscle, it pushes up a little ways and that through a valve, and that valve closes so that blood doesn't flow backwards. All right, now this is where it's really important, I feel, for us to wear compression stockings when we're standing in one place all day, because it gives us a little squeeze on our legs, all right, and that's going to help with venous return, and it's going to prevent something called pooling of blood in the veins, because if blood is just sitting in the veins, it's pushing back on those valves, and over time it can damage the integrity of those valves, and they start to bulge out. And that can also cause phlebitis, and that can become very painful. Lastly, here is venipuncture. All right, venipuncture is making a puncture into a vein. It's like when you get a blood draw. Here we're looking at an image of the stethoscope, which is that little blue thing that's coming down, and he's holding that little round thing by the blood pressure cuff. All right, listening for the pulse in the anticube there, brachial pulse. All right, and here is an image of varicose veins. You can see them there. And if you look at the image on the left, that little top bubble where it says normal vein, you can see that little W that the valve is making. It's very tight and close, and it looks normal. But if you look at the lower bubble that says varicose vein, you can see how it's distended and widened, and the valve is no longer closing anymore. All right, so let's look at some abbreviations. The first abbreviation is BP, which stands for blood pressure. All right, then we have our CABG. Remember what that stands for? Coronary artery bypass graft. Now, coronary artery disease is abbreviated as CAD, and our complete blood count is abbreviated as CBC. Now, cardiopulmonary resuscitation is CPR, And echo is short for echocardiogram. Remember, that's recording the sounds of the heart. Now, the ECG or EKG is that electrocardiogram, and that's recording the electrical activity of the heart. HF is the abbreviation we use to represent heart failure. Might also hear it as CHF, congestive heart failure. And then HTN is the abbreviation for hypertension. And remember, hypertension means that we have a blood pressure that is too high. IV is our abbreviation for intravenous, remember, within the vein. And MI is our abbreviation for myocardial infarction. What are the two different abbreviations for this electrical recording of the electrical activity of the heart? Do you remember what those two abbreviations are? If you said ECG or EKG, you would be absolutely correct. All right, what about this one? It's the abbreviation for the record of the heart using sound. That one is abbreviated as echo, which is short for echocardiogram. All right, so let's review. Do you remember what CPR stands for? That is cardiopulmonary resuscitation. What about CBC? CBC stands for complete blood count. What about CABG? CABG is an abbreviation for coronary artery bypass graft. HF stands for heart failure. And HTN is our abbreviation for hypertension. All right, let's look at some medical terms as they are identified or categorized by clinical category. So here we want to identify if these terms are diagnostic equipment or surgical procedures. All right, so the first one is a stethoscope. What do you think, surgical procedure or equipment? It is diagnostic equipment. What about endarterectomy? That is a surgical procedure. What about electrocardiograph? That is considered diagnostic equipment. A couple more. What about a splenectomy? If you said surgical procedure, you are correct. And last one here, sphygmomanometer. Diagnostic equipment or surgical procedure? That one is diagnostic equipment. Remember, that's the blood pressure cuff. Okay, let's look at a few more. Here we're determining, is it a diagnostic test or a related term? And the first one is complete blood count. Is that a test or a term? It is a test. What about arterial? Arterial is a related term that means pertaining to the artery. What about cardiac catheterization? Test or term? That is definitely a diagnostic test. What about angiography? Angiography is also a test. Remember, we are examining the vessel. And then what about hemostasis? Test or term? Well, that would be a related term. Okay, so now we're going to talk about lesson 8, which is the digestive system. So the objectives for this lesson, again, to build, translate, pronounce, and spell medical terms built from word parts, as well as those not built from word parts. In addition, we'll learn some abbreviations, and we'll also identify medical terms by clinical category. So here's a look at our digestive system, and it begins at the mouth with the lips and the gums and the teeth and the tongue and the cheeks and all of that fun stuff. And it's really just one continuous tube from the mouth to the anus. And so let's kind of trace that pathway. So, think of your favorite food, right? Mine is pizza. Pizza's my favorite food. And so we'll use pizza. So when you take a bite of pizza, right, that makes your mouth start to water, right? Maybe even when you're just smelling the pizza, it smells so good. Those juices start flowing in your mouth, right? Saliva. And when you take a bite of your food, that saliva has some enzymes in it, and it starts to break down your food as you're mechanically chewing it and grinding it with your teeth and mushing it around with your tongue and all of those fun things. And then we swallow, right? And when we swallow, food goes down this long tube called the esophagus. And it travels down the esophagus, and eventually it makes its way into the stomach. And the stomach continues to turn and churn, and there's a bunch of digestive juices that are secreted by the liver and the gallbladder and the pancreas, and all of these digestive juices help to continue to break down what we call macronutrients into micronutrients so that they can be utilized. So once the food gets into the stomach and these juices are mixing with the food stuff, it becomes something called chyme. And that chyme is eventually going to leave the stomach through the first part of the intestine, which is called the duodenum. And let me get my little pin out here and show you where the duodenum is. All right, so the duodenum is right here. Okay, this line is pointing to it right here. It's this first little turn off the stomach. All right, that is the beginning of the small intestine. So the small intestine, we have the duodenum, the jejunum, and the ileum. One of my students in the past remembered the segments by saying DJ ileum. I heard he played some good toots. I don't know. So the food leaves the stomach, enters the duodenum, and from the duodenum, it goes into the next part of the intestine called the jejunum, and then into the ileum. And like we said before, the small intestine is about 25 feet long, right? 20 to 25 feet long. It's this very long tube, and its job is to absorb the nutrients from the pizza that we just ate, right? And it's very long because we want to have this longer time for our food to be exposed to the specialized cells of the small intestine called the villi, and so that we can get all the nutrients out of the food that we possibly can. So I'm going to point out another structure if I can. So this little pouch right here is the first part of the large intestine, and the small intestine hooks into the large intestine right there. So that's where the ileum meets this first part of the large intestine, and that is called the ileocecal junction. All right, so the small intestine hooks into the large intestine at this little blind pouch called the cecum. All right, and the cecum is also referred to, or this portion of the colon is referred to as the ascending colon, because it goes up the right side of the body. The appendix is also attached to the cecum. It's this little worm right here, this little worm coming off, right? And then the colon makes a turn and it goes across the body. And remember, we said that the plane that goes across the body is the transverse plane. And so this is the transverse colon. And then it makes a turn right here on the left side at the spleen. That's called the splenic flexure. And it goes down the body. That's called the descending colon. And then it makes this interesting little jog called the sigmoid colon, and into the rectum and out the anus. And the feces is exited through the anus. That's the waste product from our food. And so the job of the large intestine is mainly to absorb water that is left in the waste product. All right. So if there's ever a situation where a bowel movement, there's a lot more water than there should be, it could definitely be something that's going on with the large intestine, where there's a bacterial infection or something that is inhibiting it from absorbing the water like it should. Now, we do have these, like I said, accessory organs like the liver and the gallbladder and the pancreas, that's job is to secrete digestive juices to help us break down that food. So, in summary, functions of the digestive system include ingesting and breaking down food, absorbing nutrients predominantly in the small intestine, eliminating waste through the large intestine and then out through the anus. And then here's just a look at the pathway of food. So again, food enters the mouth, it goes into the throat, down the esophagus, into the stomach, and then into that first part of the small intestine, which is the duodenum, into the jejunum, and then into the ileum. Now, there isn't like this dividing line where we can see the separation of the duodenum, the jejunum, and the ileum. We, in the anatomy books, they say, well, about this much is the duodenum, about this much is the jejunum, and then the remainder is the ileum. There really isn't we can't look at the small intestine and really determine where one part starts and one part ends. Right, from the small intestine, food goes into the large intestine, which again is the cecum there, and then the ascending colon, which goes up the body. It turns at the liver, that's called the hepatic flexure, goes across the body is the transverse colon, down the body is the descending colon, and then it makes this little kind of S-shaped turn, that's called the sigmoid colon, and then it continues to descend with the rectum, and then waste exits the anus. The accessory organs, here you can see the liver. The liver is the largest parenchymal gland in the entire body. It's about 4% of your body weight. So if you were to take your body weight and multiply it by 0.04, then you would get approximately how much your liver weighs. It's pretty crazy that it is so big. And you can see this little green structure that lives right underneath the liver is the gallbladder. So the liver performs multitude of functions for us in our bodies. One of those is making bile, and bile is a salt, and it helps to break down our food. And so bile is made in the liver and it's stored in the gallbladder until the body needs it, and then it's released into the duodenum there. So then we also have the pancreas that secretes digestive enzymes as well to help us break down our food. All right, let's look at some terms. So the first combining form is abdomino or laparo, and both of those refer to the abdomen or the abdominal cavity. Now, ano sounds a lot like anus, which is helpful that it sounds like the word. Appendo or appendico refers to appendix, and this is that little worm that's attached to the cecum. And for a long time we didn't really think that the appendix did anything for us at all, but we have discovered that it might help maintain the healthy microorganisms that live in the digestive tract. The gallbladder, the word part for that is chole, C-H-O-L-E, chole. And the word part for colon is colo or colano. And the word part for duodenum is duodeno. Other combining forms. Intero refers to the intestine, and a lot of times we'll use it to refer specifically to the small intestine. Esophago is the word part for esophagus. Gastro is the word part for stomach. And gingivo is the word part for gums. Now, glosso or linguo, is the word part for tongue. And hepato is the word part for liver. Additional combining forms. Ilio. Ilio is the combining form for ileum. Remember, that is the most distal portion of our small intestine. The jejunum is jejuno, which is the middle portion of the small intestine. Oro is the word part for mouth. And pancreato is the word part for pancreas. Remember, the pancreas is the organ that is both an endocrine and exocrine gland, and part of its job is to secrete some digestive enzymes to help us break down our foods. Pepso refers to digestion. If you've ever had indigestion and you've taken Pepcid or heard of someone who does take Pepcid, that is where that name comes from. Phago or phagio is swallowing or eating. And procto and recto are the terms for rectum. And sigmoido is the word part for sigmoid colon. Now let's look at some suffixes. Algia is the suffix for pain. And the book also has a couple others. It has sub, which we've seen before, which means below or under for a prefix. And then also a or an, which means absence of or without. And then dis, which is difficult, painful, or abnormal something. Okay, let's look at some terms built from word parts. The first one is anal, and anal means referring to the anus. You might have your own definition for that one. Another one is aphasia. Remember, a means without, and phasia is pertaining to swallowing, right? Or condition, excuse me. So here we have a condition of without swallowing. Appendicitis. Remember, itis means inflammation, and appendo means appendix, so inflammation of the appendix. Cholecystitis. Remember, cyst means bladder, and chole means bile, okay, or gallbladder, so inflammation of the gallbladder. Cholelithiasis. Remember the word part litho? That means stone. So here we have a condition of a gallbladder with stones, or stones in the gallbladder. Colitis, inflammation of the colon. Duodenal, pertaining to the duodenum. Dysentery is a term that we use to refer to painful intestines, and there's actually a disease called amoebic dysentery that is a condition of the intestines being invaded by a certain microorganism. Dyspepsia is a condition of difficult digestion, and dysphagia is difficulty swallowing or abnormal swallowing. And lastly on this slide, esophageal, which means pertaining to the esophagus. And here we see an angry appendix. On the right, we see a normal one, And on the left, we see a very angry reddened one. Now, we can live without our appendix, and when we remove it, we call that an appendectomy. Here we see cholelithiasis, so that big green thing with looks like some peanuts in it, that's the gallbladder, and those are some stones, and you can see how sometimes the stones can get lodged in those ducts that are responsible for carrying bile to the duodenum from the gallbladder or from the liver. And if that happened, that's a bad thing. So we have to remove those stones from blocking that pathway, but we can live without our gallbladder as well. More medical terms. Esophagitis. Remember, itis means inflammation, esophago means esophagus, so inflammation of the esophagus. Gastric is pertaining to the stomach. Remember, gastro means stomach, IC means pertaining to. Gastritis is inflammation of the stomach, and gastroenteritis is inflammation of the stomach and the small intestine. Gastroenterologist is somebody who studies and treats diseases of the stomach and the intestines. A lot of times we call these GI doctors. Gastroenterology is the study of the stomach and the intestines. And gastroesophageal means pertaining to the stomach and the esophagus. Gingivalgia is painful gums. Painful gums. And gingivitis is inflammation of those gums. And then lastly on this slide, glossitis. Remember what glosso means? It means tongue. So glossitis is inflammation of the tongue. All right, a few more here for us to look at. Hepatitis. Remember, hepato is liver and itis is inflammation. So hepatitis is inflammation of the liver, and this can be caused by a variety of microorganisms. If you've heard of hepatitis A, hepatitis B, hepatitis C, there's a whole bunch of alphabet soup hepatitises, but they are viruses that cause inflammation of the liver. A hepatoma. A hepatoma is a tumor of the liver. And hepatomegaly. Oh, remember what megaly means? It means enlargement of. So here we have the enlargement of the liver. Oral is pertaining to the mouth. And pancreatic is pertaining to the pancreas. I like to call it Mr. Pancreas. Pancreatitis is inflammation of the pancreas. And rectal means pertaining to the rectum. Erectocele, remember the herniation into the rectum. We talked about this in the reproductive lesson. And then lastly here, sublingual, which is pertaining to below the tongue. And so sometimes we refer to medications as sublingual, where they are given by putting them under the tongue. Some things that we give, like nitroglycerin, to quickly lower blood pressure if it's super high. Some diagnostic terms that are built from word parts. Let's look at those. First one is colonoscopy. Remember, colonoscopy, we are performing a procedure where we're looking into the colon, see what's going on there. All right. A CT colonography is a radiographic imaging of the colon, and a lot of times, we do this to get a better idea of what's going on, to provide a diagnosis for the patient. And we use a CT in this instance to do that. Esophagogastroduodenoscopy. Say that 10 times fast. We don't like to say it, so we shorten it to EGD. You might have heard of that. So this is basically looking into the esophagus and the stomach and the first part of the small intestine, which is the duodenum, with a scope. A gastroscope is a scope that we use to view the stomach, and a gastroscopy is that procedure of using a scope to view the stomach. A laparoscope. So if we're doing a procedure where we're going to use an instrument to view the abdominal cavity or the pelvic cavity, for that matter, we use something called a laparoscope. And then pertaining to viewing the abdomen with a scope is laparoscopic. And then the actual procedure is called a laparoscopy. So we would use a laparoscope when we do a laparoscopy. So here is an image of a colonoscopy, and typically the patient is in the side-lying position, and we don't do a lot of these in the operating room. Usually they have special clinics, GI clinics, where they do them. But the patient lies on their side, and then there's a very flexible scope you can see there that gets inserted into the rectum, and it can be used to view the colon to see if there's any polyps or tumors, or maybe everything looks fantastic. But this has become a standard of practice where they suggest that at a certain age we start getting a colonoscopy routinely. And here this is signifying that there can be these redundant growths of tissue inside the colon, and those are referred to as polyps. And during a colonoscopy, those polyps can be excised. On this slide, we're looking at some different images from a colonoscopy. So the top one is a normal colon, and usually they will use air to inflate the colon so that they can see what they're doing as they're in there. Image B, and I'm not sure if you can see it, but sometimes these little pouches develop in the colon, and they're called diverticuli, which is plural, diverticulum for one, and they're these little recesses where food particles can get trapped in there. And if they get trapped in there and they can't get out, eventually they can erode through the colon and cause a perforation. The next one is a polyp on image C. And then lastly, colon cancer, so some sort of tumor there. Here we're looking at a gastroscope. So if they're going to do an esophago-gastro-duodenoscopy, they would use a gastroscope to do that. And again, you can see that it's a long, flexible scope. And here is the image of that gastroscope up close and personal. So some additional diagnostic terms built from word parts: proctoscope, which is a scope that we would use to view the rectum; a proctoscopy, which is the visual examination of the rectum; a sigmoidoscopy, which is the process of visualizing the sigmoid colon. All right. A couple more: amniocentesis. An amniocentesis is a procedure that they use to extract some fluid from the abdomen. Appendectomy is removal of the appendix. What about cholecystectomy? What are we removing there? If you said gallbladder, ding ding, you're right, good job. Colectomy would be removal of part of or all of the colon. Colostomy is creating a new opening into the colon. So there's a couple situations where we would do a colostomy, either the patient had to have a significant amount of colon removed and we can't connect it back with the remaining intestines, and so we bring that intestine up through the abdominal wall and we attach it there, and we put a little appliance on there that would catch the waste. Sometimes these are only temporary if the surgeon prefers that the bowels need some time to rest, then they might do a temporary colostomy. A gastrectomy is the removal of the stomach, and a gastrostomy is creating a new opening into the stomach. Now, sometimes for whatever reason, if the patient can't swallow or something like that, they may go ahead and put in a feeding tube. And to do that, they insert a tube directly through the abdominal wall and into the stomach, and that would require a gastrostomy for that feeding tube. An ileostomy, again, similar to colostomy, but now we are we're advancing a part of the ileum, which is the small intestine, through the abdominal wall instead of the colon. And then jejunostomy, the same, bringing the jejunum of the small intestine up through the abdominal wall. And then lastly, laparotomy, which would be an incision into the abdomen. So here we can see an ileostomy and a colostomy, and that line is pointing to something called the stoma, and that's just the end of the intestine that we bring out through the abdominal wall. We call that the stoma. Here we can see a partial gastrectomy where they've removed a part of it and then sew that stomach back together, maybe to resect a tumor, or there's it looks like an ulcer there. Now, a laparoscopic cholecystectomy is a minimally invasive way for us to remove the gallbladder, and so that's what you're seeing here. And these weird doodads that are sticking out of the abdomen, we call those trocars. And those are little plastic tubes that we insert in through the abdominal wall, and we can pass the scope and the instruments and things in and out of those little ports. All right, so next we're going to look at some medical terms that are not built from word parts. Okay, so let's look at some medical terms not built from word parts. The first one is abdominal ultrasonography. So remember, an ultrasound is a recording using ultrasonic waves to be able to view an image, right? So here we're specifically using ultrasound to view the contents of the abdomen. Now, bariatric surgery, that is a surgical specialty where we focus on reducing the gastric capacity to treat morbidly obese individuals. Barium enema. A barium enema is a diagnostic procedure where the patient is given some really delicious stuff to drink called barium, not delicious. And this barium is also radiopaque. So it is going to coat the abdominal tract and allow the physician to get a series of radiographic images so that they can view the intestines. Constipation, not a fun time, right? Constipation is the inability to evacuate stool. Crohn's disease is a chronic inflammation of the intestinal tract, and it typically affects the ileum, which is the terminal part of the small intestine, and the colon, and it's characterized by these ulcerations on the inner lining of the intestine and the colon, and those can form scar tissue, which can eventually lead to a blockage or an obstruction. Diarrhea is the opposite of constipation, right? It's the frequent discharge of a very liquid stool instead of it being a well-formed, normal stool. Endoscopic retrograde cholangiopancreatography is a very long word that we usually shorten to ERCP. And an ERCP is an endoscopic procedure that involves radiographic imaging of the biliary ducts and the pancreatic ducts. And the reason they would do this is if an individual has a cholecystectomy because of cholelithiasis, and there are some stones that are stuck in the biliary tract, we can't leave those there. And so after they have their cholecystectomy, they may be scheduled for an ERCP to remove any of those existing stones that may be blocking the pathway of bile from the liver to the duodenum. Here is an image of an abdominal ultrasonography, and this is showing GB is the gallbladder, and ST is not the surge tech, that's the stone. All right, so you can see the gallbladder and then a stone inside the gallbladder. Bariatric surgery, here you can see on the left a gastric stapling, and on the right you can see gastric banding. Now with a gastric stapling, they permanently remove permanently remove part of the stomach and do a resection, or they can just close the rest of the stomach off and reroute the passage of food from the esophagus through just a small little portion of the stomach and then out to the duodenum. Or with the banding, they put this band around there, and then they can, this port goes out through the skin or by the skin, right under it, and they can inject saline that can control the contents that way. Here's an image of a barium enema. So if an individual does not have barium, then you would not be able to see the intestine very well. So the barium helps us to view the structure there. So let's talk about a few more terms not built from word parts. Gastroesophageal reflux disease. We shorten this to GERD. It is a disorder characterized by the abnormal backflow of GI contents into the esophagus, and a lot of times we refer to this as indigestion or heartburn. Hemorrhoids. Hemorrhoids are swollen or distended veins in the rectal area, and these can be internal or external, but they are very painful. And we can, in some situations, we can do hemorrhoidectomies for those. A hernia is a weakening in the connective tissue that holds the abdominal wall together, and that allows contents from the abdomen to protrude through. Irritable bowel syndrome, often shortened to IBS, is a periodic disturbance in bowel function, and that can be characterized by diarrhea or constipation, and it's usually associated with abdominal pain. A peptic ulcer, peptic meaning pertaining to the stomach or digestive organs, and ulcer is like an eroding away of the wall, right? And eventually over time, this can cause perforation of the stomach or anywhere along the digestive pathway. A polyp, again, is a redundant growth of tissue that extends outward from the mucous membrane, and those are commonly found in the colon if they are there. Ulcerative colitis is a disease characterized by inflammation of the colon, and this can also mean that there are ulcerations on the lining of the colon that eventually can erode through. This can also cause blood in the stool. So if the blood is really bright, then that means there's active bleeding. If it's dark, that could mean that it's old blood. Upper GI series, sometimes abbreviated as UGI, is a diagnostic procedures, and again, they take radiographic images of the upper gastrointestinal tract, like the pharynx, esophagus, stomach, duodenum, and again, the patient would be required to drink some of that barium so that they could get their radiographic images. All right, we're coming into the home stretch here. You can see some of those distended veins that would occur during or with a patient that has hemorrhoids, and not all the time, but commonly during labor, there is a lot of pushing and straining. Also with constipation, those kinds of things, but extreme strain can cause hemorrhoids. Here we see a few different types of hernias. One is the hiatal hernia, that's A, and that's where a part of the stomach herniates up through the diaphragm. There's a passageway there, it's called the cardiac sphincter, and that's where the esophagus passes through the diaphragm, and wherever there's a tube-like structure that passes through into a cavity or another cavity, that's a natural weakening and a hernia can occur. B is the inguinal hernia, and this happens in the male individual. And what can happen is, again, there's a weakening here because the spermatic cord passes into the abdominal cavity, and there's a natural weakening because there's an opening in the connective tissue. And then lastly, an umbilical hernia can occur right there at the umbilicus, as you see in image C. Here's an image of a peptic ulcer, an ulcer that occurs in the stomach, and all those wrinkly things you see, those are called rugae. Those are normal. When your stomach is not full, it has all these little wrinkles in it called rugae, and the rugae rubbing together is actually what causes the growling of your stomach, and as you fill it with food, those allow the stomach to stretch out and accommodate whatever food you ate. Here's an image of the large intestine, and just signifying that ulcerative colitis can occur in the large intestine. All right, let's look at some abbreviations. So the first one is BE, which is our barium enema. Remember, if we're going to take pictures of the intestine, patients got to drink some of that barium, or it needs to be inserted into the rectum. EGD, that's our esophagogastroduodenoscopy. Remember, we're looking at the esophagus and the stomach and the duodenum with a scope. IBS is irritable bowel syndrome, and UC is the abbreviation for ulcerative colitis. So, question for you. How do you abbreviate this diagnostic procedure, also abbreviated as a lower GI series? If you said BE, which is barium enema, you would be correct. Couple more abbreviations. ERCP, remember that's that really super long word that stands for endoscopic retrograde cholangiopancreatography, right? That's to get those remaining stones that are in the biliary tract out. With the use of an endoscope, here you see this image, biliary and pancreatic pathologic conditions are diagnosed with what procedure? Remember, biliary is our cue there. And that is our ERCP. Remember, endoscopic retrograde cholangiopancreatography. All right, let's look at some medical terms by clinical category. Okay, here we're determining specialties / profession or disease / disorder. What do you think? Colitis. Definitely a disease or a disorder. What about gastroenterology? That is a specialty, right? What about gingivitis? Is that a specialty or some sort of condition or disorder? Yes, it's a disease or disorder. That is inflammation of the gums, the gingiva. What about pancreatitis? Is that a specialty or is that a disease? That is a disease disorder. And then the last one here on this slide, gastroenterologist. That is a specialty / profession. Remember, those are the individuals that specialize in the treatment of disease of the stomach and the intestine. Okay, a couple more here for us. We're deciding, is it diagnostic equipment or is it a surgical procedure? The first one, gastroscope. That one is diagnostic equipment. Remember, that's the instrument that we use to look into the stomach. What about abdominocentesis? Again, that one is a surgical procedure where we are removing some sort of fluid, probably, from the abdominal cavity. What about a laparoscope? Is that equipment or procedure? That is equipment. Remember, that's the instrument that we use to view the abdomen. What about jejunostomy? Well, a jejunostomy is a surgical procedure. Remember, ostomy means creating an artificial opening into, and jejunum is the middle part of the small intestine. And then lastly here, what about proctoscope? If you said diagnostic equipment, you would be correct. A proctoscope is an instrument that is used for viewing the rectum. All right, so that concludes our lecture on lessons 7 and 8. I hope you found it helpful, and as always, thank you for listening.